Hello, my name is Jacob Benjamin Davenport, and I am enrolled in the Early Childhood Development course ECCE 1103 at Chattahoochee Technical College. Today, February 23rd, 2025, I will be talking about child attachment, specifically the stages of attachment, attachment issues, and attachment trauma. I found all of my information from NSPCC Learning's article titled Attachment in Child Development and NCBI's article titled Introduction to Child Development. First, I'll be talking about the stages of attachment. According to NSPCC Learning, there are 5 stages of attachment: antenatal, birth to 6 weeks, 6 weeks to 8 months, 8 months to 2 years, and 2 years or older. Caretakers must keep in mind that these stages are different for every child, and the ages of each stage can vary greatly based on the child's development. The antenatal stage is the period of time before birth. Although babies are still in their mother's wombs at this stage, they are already capable of forming attachments. All attachments that they make during this time can be very beneficial to the attachment process after birth. The next stage, from birth to 6 weeks old, is often referred to as the pre-attachment stage. This is not because the baby doesn't form attachments at this stage, but because we cannot easily observe these attachments. From 6 weeks to 8 months is when the child starts to show signs of its attachments. Typically, children at this stage prefer to be held by their two primary caregivers, typically the mother and father. From 8 months to 2 years, the child's attachments are very clear. Children at this stage usually have a lot of trouble being separated from their primary caregivers. Starting at 2 years, children begin to grow less dependent on their caregivers, and they can be especially independent if they know that their caregivers will come back after being away for an extended period of time. Next, I will be talking about the types of attachment. The 2 major types of attachment are secure attachment and insecure attachment. Secure attachment is typically developed with a caregiver who is tuned into a child's needs. When children are confident that their caregivers will always give them support, they are much more likely to be securely attached to those caregivers. The article by NCBI mentions that children with secure attachments are comforted by their caregivers when distressed, and they use their caregivers as a secure base to return to in times of need. Having secure attachment with a caregiver is directly linked to efficient development, emotional intelligence, and good social skills. Insecure attachment is developed with caregivers who neglect a child's needs. Having insecure attachment is very harmful to a child and can cause many developmental and behavioral problems. Last, I will be talking about attachment issues. There are many factors that can cause attachment issues. Most of the factors are actually on the part of the caregivers rather than the children. For example, children are at a higher risk if their caregivers have mental health problems. If they switch caregivers at any point in their development, they are also at a higher risk. And additionally, if their caregivers are highly distressed, that also puts them at a higher risk. There are many signs that caregivers should look for that indicate if a child has attachment issues. These include having an aversion to other caregivers, crying every time their caregivers leave, not responding to their caregiver, and not wanting to play or explore. NSPCC Learning states that when children with attachment issues grow older, other problems start to arise. Oftentimes, these children have trouble asking for help, starting relationships, concentrating on difficult tasks, and calming down. In conclusion, understanding child attachments is crucial because it helps caregivers to better understand their children. This helps them to provide proper care and allows children to develop the best that they can. Not understanding these attachments can lead to many problems for the child immediately as well as when they are fully grown. Caregivers need to be very conscientious about making their children feel secure so that they can properly develop.